You mentioned wisdom teeth there. Let's talk about why those are such a quote unquote issue for so many people. And then for somebody that needs to have them extracted, is there anything they should be mindful when it comes to the practitioner? Obviously, you want to find a good practitioner, but like, what is it that is the difference between having it done by somebody who is just, doing average work versus the best?
Yeah, important question to expand on. Very common. For everyone that's listening, think in the back of your mind, did you have your wisdom teeth taken out? I would say probably 90% of you have, and probably the other 8% needed to have them out, right? So why is that though? I mean, our ancestors didn't have oral surgeons. We didn't have that rite of passage at age 17, 18, or before you went to college or before you went off to war, where you had your wisdom teeth taken out. Well, there's a reason for it. And it goes back to the size of our jaw. And again, it's that last 1% of our, the timeline. We've had a completely different environment, completely different diet in that last 1%, let's say the last 500 years. And because of that, we have to have our wisdom teeth taken out. So think of the jaw coming in, and it's growing in width, kind of a downward forward kind of growth. The upper jaw has to expand. The tongue is part of that equation. The tongue has to be in the right position. You can't have a tongue tie. You have to be eating solid foods, not this pureed baby food. Breastfeeding, a year or two of breastfeeding would have helped because that helps with the tongue. And it's the muscles of the face that kind of shape the face as it grows. It's very malleable, but we're not growing correctly. We don't have those big jaw lines. We have V-shaped faces, pushed back faces. And because of that, the jaw is smaller. But guess what? The same number of teeth are coming in. If evolution was working perfectly, we would be, growing less teeth. And then we would just have smaller jaws that wouldn't really fix anything. But so the last teeth that come into the mouth, there's no room for them. It's like you're filling up a room in a storage locker, and then you open that storage locker one day and you've got two pieces of furniture in there, and you're like, oh my God, I'm going to have to rearrange everything in the storage locker to get these two big armoires in there. That's basically what happens at around between age 15 and 22. It can be a little bit later. It depends. But so what do? Do you take everything out of the storage locker and rearrange it? Do you throw out some furniture? This is what orthodontists do, and they do it after the fact, which is not the time to be doing it. We know that this happens. Why aren't we being more proactive? So that's kind of the why. So, and I can go down that rabbit hole all day long. It gets me all emotional. It's such a thing that really has been not forgotten, but overlooked in dentistry. But anyway, so we got the last teeth coming in, upper two wisdom teeth, two lower wisdom teeth. It's the third molar. There are some people that are born with four molars, and there are some people that are born without third molars. Some people say you're more highly evolved if you don't have that third molar. That's hogwash. Those teeth come in, and they have nowhere to go. So what do? They go sideways. They go out towards the jaw. They go into the roots of the tooth that has erupted already, that very important second molar. They can go sideways. They do try and erupt, but the jawbone is ascending already to the condyle, to the joint here. So it's sitting in bone. In the upper areas, they'll go into the sinus. They'll go sideways. They rotate. They will go into the sinus. They will go into the root structure of these teeth. They'll kill those teeth where you have to lose your second molar. When you take this tooth out and you wait too long, the upper wisdom tooth, that's what happened to me. Again, my parents, we weren't really able to afford a lot of dental care. It was just very basic. I didn't even go in for cleanings on a regular basis. And then when I got to dental school, I was 25 years old. They looked at my wisdom teeth. We took a Panorex, and it's like, oh, this guy would be great teaching moment right here. He's got impacted wisdom teeth, small jaw, everything. I'm like, oh, stay away. So I finally, third year of dentistry, actually, no, it took longer than that. I had to find a surgeon that could handle it. I was a difficult case because there was a worry of a perforation of the sinus. So anyway, but so ideally take those teeth out before they become difficult to remove. Take those teeth out before the time, if you do remove them, you need a lot of bone fill to fix the defect or the space. We're talking about cavitations here. And also it's easier for the patient. So I had mine out late in life, and it took me 8 years to find the right surgeon. He did an incredible job. Had to go back a few times. I've never seen him sweat in my life. This guy is so talented. He's still practicing. And he, to this day, I'd refer him a lot of patients. He was actually right next door, ironically. To this day, he always tells my patients, "Oh, Burhenne, yeah, that was my most difficult case for just regular wisdom teeth removal." And they're like, "Whoa, that's crazy." Anyway, get them out when they're little round balls, little marbles, no root structure, and they roll out. The patient's young, they heal well. The only problem with that is that young patients don't take post-op instructions very well. So make sure you get the post-op instructions to the parent, and deal with it then, because the jaw may not grow to its full potential. Typically, it doesn't. You can intervene between the ages of 2 and 7 or 8 and expand the jaw in hopes that you can fix that. And that is possible. And then maybe there is room for the wisdom teeth, but don't wait too long. A lot of patients are like, "Oh, it'll fix itself." It won't. And it always happens at the worst possible time. This is why when you join the Army, they take out your wisdom teeth, because you're out there in an M1 an Abrams tank, and all of a sudden you're incapacitated, or you're a pilot, or you're, flying a bomber, and you just, I mean, that's how bad wisdom tooth pain is. So typically it's done before you go to college, because in college you're kind of at the mercy of whoever is available. You're not home with your parents, and then you recover from the surgery in a dorm with, in a fraternity. Here, gargle with this beer. This will help. So anyway, it's something that unfortunately needs to be done often. So find the right surgeon. You heard my story, right? I would do an oral surgeon. They're set up for it. They do it all day long. This is all they do. Ask them, what is their incidence of nerve damage? I think it's a fair question to ask, and it should be 0.1%. It's a little high, but ask them that question, because that's one of the, if you wait too long and you are aggressively have to remove that lower wisdom tooth, you can damage the lingual nerve to the tongue. It typically repairs itself, but not always. So make sure you're using the right guy. Make sure on our website, we have a blog post on what to do before and after. It's quite a long blog post, and what to buy, and Amazon links on what to prepare for, what to drink, what not to eat before, how to keep your head elevated. That's a big one. That surgeons never tell you that. Don't lie down flat afterwards. You're going to get a lot of pooling blood and a lot of inflammation. Get one of those wedge pillows. Stay elevated for 2 or 3 nights. That helps a lot. Use ice. But anyway, it's an unfortunate necessary evil in our society today. And you don't want to be one of those people that says, that's not going to happen to me. Or my favorite is, that's just a big scam that dentists do. It's not. Blame big food if you want to blame someone, agriculture, lifestyle, whatever. But don't blame dentistry. We're doing the right thing.
For somebody that's tuned in to what we're talking about today, and they're able to breastfeed and do all the things with the child right from when they're born, do they have a chance? You mentioned the palate expansion, but that's obviously an intervention. How often would you guess somebody that's living a natural lifestyle, doing the things we're talking about today, is going to have a normal palate? Or is it just the de-evolution to this point and we're just basically all screwed?
That's a really good question. And the answer is we really don't know. There is some de-evolution going on. There is probably some genetics at play here. But let me tell you a little story. One of my favorite dental stories. So I had a patient once. It was a family that just recently immigrated from Eritrea, which is near Ethiopia in Africa. Lovely family, amazing. He ended up being an engineer at one of the big chip companies in the Silicon Valley, and she brought in her kids, two kids, two boys. And the first time I met them, there was a little bit of a language barrier, and they were very respectful of the professional environment. Again, that's what it's where they come from, and it was kind of like you do whatever you need to do. He was a 4.5-year-old boy, and the minute I met him, he just jumped in the chair and he opened his mouth. And I'm not used to that, of course. Most American kids are, they're defiant, and they're usually protective of this because they can't breathe through their nose. So of course they're going to protect this. They don't want hands in there and fluid and water and rubber dams and all that, because that's their main airway. And then mom's there and they can complain, and then mom comes over, and every dentist knows what I'm talking about. But anyway, this boy was wonderful. And so I brought down the chair and I asked the mom some questions. I wasn't able to get a lot of information, but my first impression was this young boy has the most beautiful smile I've ever seen. I mean, it was at first I didn't know what to identify that made it beautiful. I mean, I had to look at him first, but it literally knocked me over. Beautiful white teeth. Usually, the teeth are a little yellower at that age, and it was broad, perfect lip line. His mouth was closed the whole appointment, except when he was speaking or when I was examining him. Beautiful facial structure. So as I got to know him, I was looking at his tongue and the position of his tongue and the width of his arch and all that. And so at the end of the appointment, and again, he was not fearful. There was no fear at all, no anxiety, smiling, and he was able to keep his mouth open. He was breathing through his nose. So to make a potentially longer story here shorter, when he jumped out of the chair, he ran over to his mom, kind of jumped on her lap, leaned back, pulled up her sweater, and latched on. He was still breastfeeding. He had just come from Eritrea, so he hadn't been eating junk food. Later, from the dad, who was the English speaker in the family, I found out that he was eating raw meat, not sticks, but raw tenderized meat that was dried on lines. He was eating a lot of like beans, no rice, no grains. What else? There was something else. There was some kind of curd that they were eating, and they weren't eating a lot. But this was a healthy young man. So over the years, by the time he turned 14, 15, and then later 18, 19, his wisdom teeth came in. And usually, even if wisdom teeth come in, there's still a bunch of tissue on the back end where you can get pericoronitis, which is a slight swelling of that gum tissue, or the tissue sits high. He had, and Dennis will appreciate this, he had about the clinical crown of the distal part, the back part of the tooth, was completely exposed. In other words, the tissue was right at where the enamel ends and the root, the DEJ, where the root portion starts. I had never seen anything like that. But again, he didn't grow up in the U.S. He didn't have the diet of what we have here. I would talk to the parents about what they were eating, and he would bring in his lunch sometimes, and it wasn't a typical American lunch. There were never any bags to rip open or bars or anything like that. And he drank a lot of milk, and he developed properly. And so I guess the answer is that in today's world, you can still see that. When we go back to studies where we can excavate 800, perfectly fit young men that were buried after they built a pyramid in Egypt, that's 4,000 or 5,000 years ago. We look at their jaws and they're amazing. They're perfect. Everyone had room for wisdom teeth. There was a little wear on the teeth. There was some grinding, probably grains that were milled in stone, little particles of stone, abrasive diet maybe, but incredible wide arches, no crowding. We could see the teeth, obviously. We could see the jaw. We could actually measure what their diet was based on the DNA that was in calculus on the back of their teeth. Amazing. So it's still possible today, but the answer is it's not the norm, unfortunately.
You mentioned cavitations. This is something that's often talked about in the natural health realm, where somebody like me or you gets tuned into this later on after they've already had their wisdom teeth out years ago, and having a special cone beam, I think it's called like a cone beam x-ray.
Yep.
to see if there's inflammation and an issue where the wisdom teeth were taken out years ago. Talk about how common that is and what exactly is happening there.
Right. So again, very controversial. I'm not saying that cavitations don't occur and exist. They do. I've seen them. But there are a lot of dentists that they have a cavitation business, and they take an X-ray and they see a radiolucency or a space, and they ask, "Did you have a wisdom tooth there? Was it removed? How was it done?" Oh, okay. Well, it's probably has an epithelial lining. So if there's a space in the bone, like a hollow piece of the jawbone, and if it's growing, and if it does have an epithelial lining, and there's an infection, then that is a cavitation. It has to be removed. It has to be scraped. It has to be filled in with bone, grafted. But how often does that happen? Not very often. So if the extraction is done properly, you don't see it often. There are a lot of extractions being done improperly, being done too quickly. They're leaving scar tissue in there. They're not curetting out the socket. They're not handling it properly. And even then, the cavitation never occurs. But cavitations do occur. So if you do see, a lot of people are looking for that magic bullet, like I'm sick, I'm continually sick, my joints hurt, my CRP is elevated, I don't have a lot of energy. These are patients I come across a lot. And they say, I think it's my cavitation. Can you just take care of it? And I say no. I say there's a lot more to deciding whether if it is the cavitation. Let's do a complete health history. Let me speak with your physician. Let's find out what the root cause is, and let's look at your CRP. When did it elevate in relationship to when did the symptoms start in relationship to the surgery? There's usually a delay there. It's very complex, and there's no rubber stamp for it. So if you think you have a cavitation, and you should see the right person, but the right person may be, you may pick them up online because they're a cavitation expert. Well, if that's all they do, I'm not saying that's bad, but be careful because, if you have a hammer, everything that's going to look like a nail or whatever that expression is, a little bit of that is true. And I'm thinking of one person here in the US that bases his whole Instagram presence on this. So it's not as common as you would think. But it can happen, and it would have to be dealt with properly. And a general dentist typically is not set up for this. And remember, it wasn't too long ago that dentists that really pushed this agenda would lose their licenses. And so it's a fine line. It has to be scientific. Get it biopsied. Make sure there is an infection. Make sure that you are fighting an infection. There are many ways of systemically testing for that. If that's not being done, then and you're just basing it on an image, go see someone else. Get a second opinion. I'm not saying that it isn't a cavitation based on the image, but that you need more information than that because it is a difficult surgery. It's expensive, and you would be very disappointed if your problems didn't go away after all that. Because sometimes you're just scraping a traumatic cyst, or a traumatic cyst is typically harmless. A lot of people are walking around with little cysts, but there's no epithelial lining. It comes from some sort of early trauma to the face. My wife had a traumatic cyst for a long time. Never bothered her for 40, 50 years.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.